So let's first start out by talking about mental health concerns and identifying them in the workplace. So we just got done with our big global culture study here at the OC Tanner Institute. And when we were investigating mental health concerns and we asked employees to start defining what these looked like, I think you'll see common things that are probably said around your office or in your workplace, like excessive work demands, maybe lack of fulfilling work, no advancement for opportunity, underappreciation, stress from financial insecurity. These are phrases that people are commonly talking about. When I started to hear these, the thing that kind of came to my mind is these are common terms that start to really mask mental health concerns, the subclinical symptoms, maybe burnout, also depression, lack of satisfaction, sadness, not finding satisfaction in previously satisfying activities, or even generalized anxiety, that fear about an uncertain financial future. And so we really started to think carefully of these things. Overall, what we ended up showing in our most recent global culture report is that culture can really impact mental health. Poor workplace culture can really detract from mental health. I think this is kind of an intuitive statement in that we know that inhospitable cultures are probably going to have a great impact on mental health concerns. But at the same time, we can promote healthy culture and workplace cultures that uplift and alleviate mental health concerns. And when we started to think about this, I specifically was really interested in how, and my team as well, how we can find these indicators of mental health concerns within the workplace. What I'm going to encourage you to kind of look at is some of these top indicators, and I just ask people yes or no. Would you say this about yourself? Would you say this about your workplace? And we have the top indicators of probable anxiety and top indicators of probable depression. And I'd encourage you to just look at some of these things and think about maybe that one coworker that you're like, oh, yeah, my coworker said that, or my coworker's done that. Maybe they're feeling stressed about work. Maybe they're mentioning that the team is toxic. Maybe they're not coming into work every day on time because they're struggling to get out of bed. Maybe they're feeling a little bit lonely. And maybe at times you've been saying that they hate their job. And when these things start to come together, maybe we need to start thinking about, our mental health concerns present. Should we be more mindful of these individuals? From here, I want to talk about the impact of a healthy culture. We just got done talking about some of the indicators of maybe what people could be saying in a negative culture, but what is the impact of healthy cultures, right? When purpose, opportunity, success, appreciation, well-being, and leadership are there, we see pretty sizable decreases in the odds of burnout, the odds of probable anxiety, a probable diagnosis of anxiety, and the odds of a probable diagnosis of depression. But something that I was really excited about, especially as a clinician, as well as somebody that wants to improve workplace culture, is these last two here, which a lot of our most recent study was devoted to these aspects of survive and thrive. And we see pretty large reductions in the odds of burnout, the odds of probable anxiety, and the odds of probable depression, especially compared to the rest of the areas that we investigated.